Nursing is more than a career. It is a commitment to care, compassion, and making a difference. We would like to introduce you to some wonderful nurses who share what this profession means to them.
So I was diagnosed with JRA, juvenile rheumatoid arthritis, when I was 12. My mom was a respiratory therapist. I shadowed a PA when I was in high school, and I hated it. I wanted to intubate. I applied to PA school, got waitlisted, so then I was like, nursing is a great opportunity. You have multiple different avenues to go into. You can do outpatient, you can do inpatient, you can do critical care, you can do pediatrics. So I thought it was a great opportunity to expand knowledge, and if you don't like a certain job, you can go to a different one. Specialty, I guess. So I lifeguarded when I was young, and then I did a New Visions program when I was in high school. So it's like you shadow different specialties. I did shadow with the fire department. I watched like labor and delivery, that kind of stuff. And then it led me to go to Russell Sage College, where I went to nursing school. I got my bachelor's, and then I worked as a tech when I was in school. And then I've been working as a nurse for 3 years now. I think teamwork is important. I think that admitting that you don't know something and asking questions is really important. I feel like a lot of nurses or new grad nurses, want to act like they know a lot, and you do know a lot, but there's also a ton of stuff that you don't know, and you learn every single day. And then I don't know, I think being able to communicate with all different parties, respiratory, physicians, patients, family members, being able to just have that open communication is very important in being a nurse.
All right, so my name is Craig. I've been a nurse for going on 3 years now. I just started here in the emergency department not quite a year ago. Prior to that, I worked in medical ICU setting. So that's kind of my background. I guess as far as what makes a good nurse, I would say just somebody, I think time management is a huge thing. Whether it's in the ICU or the emergency department, you're constantly being pulled in different directions. You have orders coming in constantly, and just being able to manage your time, constantly reprioritize your patients, and just have like a big picture mindset and try to adjust your time accordingly. So I think that's the biggest thing for being a good nurse. My favorite thing about being a nurse, I think when I came into it, something that is always like been kind of like my guiding thing that I look at is really trying to humanize medical care. I think a lot of people get overwhelmed with the doctors when they talk to them and diagnose them and give them treatments, and just trying to really explain that to people in a way that they can understand, and also just making it more personable, like talking to your patients, getting to know them, relating to them on a human level. I think that just kind of really transforms their experience with healthcare. I think the nursing field is a great job. There are a million different directions you can take this degree and this career. I think it's challenging. There's like not only from the scientific and knowledge that you're constantly always learning, as well as the skills you're always gaining, and then you can always kind of advance or change directions. I think it's a great field, and you always are employed. So yeah, I'm loving being a nurse. No regrets.
Hi, I'm Mel. I've been a nurse for 25 years and I work in the OR. And my advice to anyone thinking about nursing is to do it for the right reasons and know that it's physically and emotionally demanding.
My name is Cody. I've been a nurse for 13 years. I also work in the OR. And I think qualities that would make a great nurse are someone who is a team player and someone who can balance clinical skills and compassion.
My name is Mindy Dame, and I'm the Director of Nursing for Women's and Children's Services in OBGYN at Southwestern Vermont Medical Center. So I have been a registered nurse 24 years, and I was a licensed nursing assistant for 2 years prior to nursing. I became interested in nursing after taking care of an elderly couple in the community and realizing that I could help make a difference and help people that are my neighbors, family, and friends. So I've been on a continuous pathway to where I'm at for many years. I have done my education in segments as I've gained clinical experience both at the bedside and at a leadership level, both in academic tertiary care medicine and rural community health medicine. So it's been a lot of perseverance, a lot of grit, and always believing that you can achieve what you set out to do. I think that the pathway is different for each person, and there's many pathways out there in the nursing world today. So I would say my top two are compassion and empathy, because if we ever stop losing those two things for the people that we're serving, then we should do that internal evaluation, because they are relying on us to be those people at their most vulnerable times in life. And then the third quality I would say is to be a good human, be engaged, be collaborative, be professional, and always have that desire to want to grow, learn, and make a difference.
Awesome. Sweet.
I'd say I decided that I wanted to go into nursing when I was in high school, and I had a great aunt who I was close with and did a lot of game nights with, and then she had to go on hospice, and I was there when the hospice nurses were visiting her, and I saw how much they cared for her and what a difference she made to my family, and that made me think I could do that. So that is what really inspired me to go into nursing. I'm lucky that I hold two positions in nursing. First, I'm a nursing instructor for VTSU for the ADN program, and I work with students once a week on the med-surg floor, acclimating them to the complex environment of med-surg patients. And my other job is I'm assistant director of inpatient nursing at Southwestern Vermont Medical Center, and I work with management. So I'm middle management, and I support the nurses and leadership.
Okay.
My path to becoming a nurse is I went to what was VTC at the Randolph campus. I went there for my LPN year right out of high school. So I became an LPN when I was 19 years old. And then I did that for 8 years, worked in long-term care as an LPN. And then I finally got enough confidence to go back to school for my associate degree. And I also went to VTC for that. Graduated in 2012. And I was lucky enough to get hired at the hospital where we were doing our clinicals. I bridged to my bachelor's degree in 2016, and then I earned my certificate in critical care in 2018. And then I just finally graduated with my master's degree in December of 2025. So it's been a lifelong journey of continuing education and always trying to challenge myself. I would say everybody's going to be different, but I really liked how I was able to build on it and get a number of years of experience at each different level, which really gave me appreciation for the different levels of nursing that there is. And it also has given me the opportunity to work while I'm in school, which is good for making money, but also good for taking those nursing practices and really implementing them right away, incorporating them as I was learning them. What would I say to people who are thinking about going into nursing? I would say there's definitely a need, and that it's hard work, but it's worth it, and that you get to work on a team, you're not on your own, and that nobody ever knows everything. So expect to be always learning something new every day.
If you are considering a career in nursing, getting started can feel overwhelming, but there are many more options available than you might think. A great first step is exploring your interests, talking to others in healthcare, and looking into local programs. It is also important to check with your current employer, especially if you are already working in healthcare. Many organizations offer support like tuition assistance, flexible scheduling, or career pathway programs. Taking time to research different colleges and programs can help you find a path that fits your goals, finances, and your life.
When exploring a career in nursing, one of the first steps is looking into local college programs and understanding your options. In Southern Vermont, we're uniquely positioned with access to nursing programs across multiple states. Whether in Vermont, Massachusetts, or New York, there are many options available, from community college programs to hospital-based opportunities and university degrees. For example, many of us are currently enrolled in Vermont State University's nursing program, which offers flexible pathways to begin or advance a career in nursing. VTSU has campuses throughout the state, including locations like Bennington, Castleton, and others, allowing students to learn in their own communities while gaining hands-on experience in simulation labs and clinical settings. If you're interested in getting started, reaching out to an admissions advisor or visiting the Vermont State University website is a great first step to learn more about the options available to you.
Many healthcare organizations offer programs to help support employees who are interested in becoming a nurse or continuing their education. For example, at Southwestern Vermont Medical Center, there are opportunities available to employees like the RN Pipeline program, which helps support staff as they move through LPN and RN training.
These programs may include tuition assistance, scholarships, and even paid study time while working reduced hours. There are also opportunities to continue your education, such as support for advancing from an RN to a bachelor's degree through partnership programs. If you're already working in healthcare and thinking about nursing, it's worth talking with your employer or HR department to learn what options are available to you.
If you enjoy working as a part of a team,
if you want a career that is always evolving,
if you believe kindness can make a difference,
if you want to make people feel seen and heard, if you care about advocating for others,
then the future in nursing may be waiting for you.